of the most crucial pieces of universal precautions is making sure that we can actually utilize our hands when an individual has any type of bloodborne pathogen present. So one way that we can do that is to utilize disposable gloves. Now the gloves that I have here are not latex, they're nitrile. The reason for that is that many people have latex allergies, so this prevents making sure that they don't have those particular problems. So the primary skill here is taking them off, but I also just wanted to demonstrate making sure that you appropriately put them on as well. So you want to make sure that you have the right size, because if they're obviously too small, that's going to be very problematic to actually get them on. And we really want to get them on quickly, because if we're putting on gloves, it's usually because somebody is bleeding and we want to be able to treat them. And the quicker that we can get our hands covered is going to be beneficial. Ideally, you wouldn't want to have any jewelry on as well, because sometimes if you have large pieces of jewelry, especially rings that have large diamonds on them, and you put the gloves on, that can actually rip through the gloves and that can create a problem. So once you get the gloves on, just take a look and make sure that you haven't put any holes into them. Sometimes the gloves get old and brittle and you put them on very quickly and then they just tear a big hole, and that's a problem. So now that we're ready to go, we can do our skill, we can do manage whatever bleeding issue that might be present. And once we're done, we want to dispose of these gloves. We want to make sure that we don't touch anything and get that surface or area contaminated. So we want to get them off without really touching any significant surface. So the way that we do this is kind of a two-step process. The first way is that we want to get one glove off. It doesn't really matter if it's the right or the left, but what you want to do is you just kind of want to pinch at the very palm of your hand and use that to kind of pull the glove off. So you've got it kind of contained right here. Now this hand is clean, so we want to make sure that we don't touch anything with this. So we just ball the infected glove into the other palm of the hand. And then what I'm going to do is I'm going to take my finger and I'm going to press up underneath, so I'm not touching the actual outside of the glove, but I'm touching the inside of the glove. And that allows me just to pull and flip this off, which gives me a nice little kind of pouch by which everything is now self-contained into here. Now this actually goes into a bloodborne pathogen bag or a bloodborne pathogen container, so that way it can be disposed of appropriately. Once the glove is off and disposed of, then now this is the appropriate time to wash your hands. You can either wash your hands with soap and water, or you can wash your hands with a waterless hand sanitizer. But other than that, we're good to go.